I wanted to review what is a Vectra test. If you're continuing to have joint aches and pains, I'd like to obtain additional laboratory studies to include celiac antibodies, Saccharomyces antibodies for Crohn's if you're having diarrhea or abdominal pain, a Vectra D test, which is a test for inflammation, a Lyme's titer if you're having any insect bites, travel to wooded areas, a chest x-ray for possible sarcoidosis, unless you've had one done recently, to explore for other types of arthritis and inflammation, as well as like to consider sonograms of the hands to look for inflammation. Now, the Vectra test was developed by Crescendo Bioscience, which is a multi-biomarker blood test for assessing rheumatoid arthritis and inflammatory arthritis disease activity in patients treated with DMARDs, or disease-modifying anti-rheumatic diseases and biologic drugs. In your particular case, I'd like to pursue it to see the degree of inflammation. The Vectra DA assembles a panel of 12 key proteins that have been associated with rheumatoid arthritis into one test, which produces an objective quantitative score to related disease activity. The score 0 to 100 helps doctors make treatment decisions as they go forward. The score is on the basis of 0 to 100, with lower score indicates less disease activity. Indicating your score is essential. 45 to 100 indicates a high level of disease activity. 30 to 44 indicates moderate disease activity, and 1 to 29 considers a low disease level of activity. It is not to be used for the diagnosis of rheumatoid arthritis, but to assess disease activity. The level of the score can help with predicting possible radiologic progression or joint damage with rheumatoid arthritis following the degree of disease activity. Low disease activity less than 29 is 0. Moderate disease activity 30 to 44 is 3.4. High disease activity greater than 44 is 20.9. The level of disease activity will help determine further intervention. Thank you.